We meet daily with the primary care networks, adult social care, community health services, mental health teams and with our acute hospital colleagues. We discuss patients over the age of 70 who have had a decision to admit entering Mid and South Essex Foundation Trust hospitals. We also discuss under the age of 70 patients if identified with a need. We discuss what was happening for that patient prior to admission, like were they coping, did they have any care needs, what was their health status. We then discuss how we can support the patient to be discharged with a home first mentality. If that patient cannot yet be discharged, all the information is given to the wards so they can prepare for discharge ASAP. We know everyone is busy, so the challenge initially was getting everyone on board. However, once everyone understood the benefits to the patient, this became a little easier to solve. Whilst initially meeting daily was difficult, we have now found this gives us a great opportunity to prevent unnecessary admissions for patients and to support patients coming home with the correct care and support. We've had an example of a patient who had been admitted numerous times to Basildon Hospital. We discussed them at our TOCH daily huddle and realised they needed more wraparound care in the community. We liaised with the integrated discharge team in Basildon to ensure they had a package of care on discharge. Our community matrons agreed to visit the patient once they were discharged. And once we had put this support in place, the patient was no longer admitted to hospital and is still managing well at home.
I think some of the barriers are that the acute trusts don't necessarily know the services that the patient are linked in with in the community. Likewise, we don't necessarily know what's actually going on in real time with the patient in the hospital. But if we're having those discussions on a regular basis, we can identify how we could facilitate, smooth the process. I think there's been an impact because we're aware of patients that have been admitted to hospital. We're able to discuss those patients, to discuss the barriers to discharge. It's improved working with other agencies in the community. We're discussing patients regularly, so it's improved local working with other teams.
So I'll get all the information. We have the meeting at 10 o'clock and then we will discuss as a team of what's the best discharge for this patient. So we'll discuss that. All of mine go into BERT, Basildon Early Response Team. So I will check every single morning who's been discharged. Once they're discharged, I will then always do a welfare call and make sure they're okay and making sure that the right teams are in place for the patients to get the correct support to hopefully not go back into hospital. Make sure, of course, for them, peace of mind, they've got all the support that they need. Then I will follow it up normally 2 weeks after, little monitor, and then I close it. And I do that for every patient that comes to me. I'm finding that the patients, even just with the welfare call, say they didn't need any support and everything went well in hospital, just for the welfare call, that they're so happy. Most of the comments I get from them is, oh, you really do care. Isn't it nice that you care and you've just took time to call me? So we'll give them a call, normal chat, and then we'll just make sure. And sometimes they'll go, no, I don't need anything. But by the end of the conversation, you realise there are some bits that you can help and may lead on to even more support. Gentleman went into hospital, we've done TOCH as normal. He then come out, we've done the welfare calls, and unfortunately he did need some more support. His house unfortunately was a hoarder, so it was very unsafe for him. It wouldn't have been long before he would have fell and then gone straight back into hospital. So we managed with the family and his consent, of course. We went to the home, worked with the social prescribers here, got all the house all sorted. He then agreed, finally, because he was never agreeing to carers, but he finally did because he got our trust. This is the whole point of getting the trust built with them, realising that we are there to help you. It's not just our job, we're here to help you. When they realised that, they then agreed to it, so that he agreed. And actually yesterday they went and done another home visit to him. He's smiling, he's happy, always says thank you, house is clean, he's getting care. Absolutely the best he's ever looked. And that's just with all the teams working together.